Primary care is a necessity for all students on campus, whether that be getting a medical clearance done, getting a general physical visit, or just coming to campus for an immunization. The Student Health and Wellness Center has many resources available for students here on campus, and that's what we're here to talk about today. So let's get into it. Today we're talking about primary care here at UC Davis. This service is offered for free for students who have UC SHAB, and for students without, it comes at a small fee. And today we have with us here Nurse Practitioner RJ Jacolbia, who works at the Student Health and Wellness Center here at UC Davis. Thank you so much, RJ, for being with us here today.
Yeah, I'm glad to be here. Thank you for having me.
So for our first question, we just want to get to know you a bit more. So can you tell us about how you became a nurse practitioner and what inspired you to work with UC Davis students?
That can be a very long answer, but I guess a little bit of background of myself. I was born in the Philippines, came here when I was 3 years old, and first generation person and first person in my family to attend a university. I went to UC Irvine undergrad. And then after that, I spent like 10 years figuring out what I want to do. Always had a thought that I love science, I loved helping people, and I love that intersection of like direct patient contact care and really being there to help someone in their need. And so, I did lots of things from like waiting tables to doing research, volunteering at free clinics, working as a medical assistant. And I have a lot of healthcare workers in my family, including nurses and other doctors and whatnot. And nursing just kind of resonated with me. And for the longest time, I thought that wasn't what I wanted to do, because it was very stereotypical from my background being Filipino. But then I just embraced it, and it was something I really loved, and that's where I'm here now. As for this population, it's been my fifth or sixth year being a nurse practitioner, and in the beginning, my career, I worked a lot with immigrant population in Oakland, so mainly first generation from Asian populations from Southeast Asia, mainland China, Taiwan, and I did that for some time. And I eventually just moved over to student health. I've always had a passion for working with students. I myself, as I mentioned, had SHAB. I had SHAB. I didn't have SHAB when I went to UC Irvine, but I did have SHAB when I went to UCSF, and I used it to its full capacity. So it was kind of a nice segue to really provide the care back to the people who gave it to me. So it's kind of full circle. But yeah, that brings me to here today, and it's been a joy and very refreshing working with the students.
And that's so cool. She also went to a UC and how all the experiences of us being on campus as well.
Yeah, it really is nice, and I get a lot of flashbacks talking to students and remembering how it was. And I'm not too far removed from being a student, so it's kind of nice, and it really reminds me of the great and the bad times that I had as a student and how difficult it can be, the highs and the lows. But in my experience was, like most students, very, very all over the board, but overall great.
Well, that's great. And just kind of get into the services that we offer here on campus through primary care. So just what are the different resources that students can look forward to through the primary care department?
Student Health and Wellness provides a lot of services, from primary care to acute care. We also have on-campus lab, x-ray. We also have some specialty services like physical therapy. We have psychiatry, counseling services, that's like therapy and whatnot. We also have some other specialties, including OB-GYN, so obstetrician gynecology. We also have sports medicine, some rotating ortho, endocrinology. Other specialty things that we have that aren't really commonly advertised is we do provide gender care here, gender-affirming care. We also have a very robust travel clinic, so that comes from immunizations to giving medications for when you want to go abroad, because UC has a lot of travel abroad programs.
Yeah, so when a student signs up for a specialty clinic, or for example optometry, do you have to first go to a primary care provider and then get recommended to optometrist, or can you just book it directly?
That's actually a really great question. I think for optometry specifically, you don't need a referral. Okay. And I forgot to mention, we do offer that here on campus, and you could just go see the optometrist. You don't need a referral for that specifically, as well as dental. Dental is covered under SHAB. However, it doesn't fall under the realm of the Student Health and Wellness Center. You would have to go to the website, and you could find a dentist that way. As for most specialty appointments, that being seeing ortho, sports medicine, or any other outside specialists like cardiology, dermatology, any of those, you would need a referral. So you want to see your primary care provider. That also counts physical therapy. You would need a referral as well. If you are ever unsure what you need to do, you could also just talk to your primary care provider, and they'd be glad to help navigate that for you.
So you first book an appointment with the primary care provider, and then everything else kind of follows after.
Yeah, depending on what you have and the needs that you come with, we can help figure out and talk to you. A lot of us do practice a very patient focused, patient centered approach. So whatever you need, and we want to try to advocate and get you the services that.
Well, that's great.
Yeah.
So how does a student book an appointment? Is it all online? Can I call or come in person?
For most appointments, you can book online. You could call in our number, come in person. And those are the three main ways. The way you start is either you are seen in primary care or you're seen in our acute care. And that's typically the links of getting care in the first place.
Okay, got it. And then on your website, it goes talking about continuity of care. So could you go over that a little bit and like how that relates to patients and why it's important?
That's a really good question. I think a lot of the primary care providers here, the doctors and nurse practitioners, really want to focus on that. And I think in the short answer, continuity of care is kind of building that rapport with your provider and patient and really helping you in the long run. Some of these things we're not going to be able to fix in one visit. We need to see you once, do some evaluation and monitor, and this can go on for months or shorter than that, but it's nice to see the same provider so you're not always answering the same questions and you don't feel like you're starting from day one every time you see a provider. So that's ideal. Everyone's assigned a primary care provider coming in, so you may not even know. Like you could just come in and you're assigned with me and I'm like, oh yeah, I'm your primary care provider, and I'm like, and you answer like, I have no idea what that means. But basically you're assigned with me and ideally we'd follow up with together. However, you could always change it if you prefer someone else, like a female presenting provider or someone that you feel more comfortable with for some color, all these things. So make that known and we'd be glad to help accommodate. But in general, if you have a chronic issue, it'd be ideal to see someone regularly. Say you have asthma that needs to be monitored, it'd be best to see your primary care provider so they're familiar with your situation and monitor versus, oh, I have an asthma flare, I'm just going to go to urgent care. I have asthma flare, I'm going to go to the emergency room. You're kind of getting broken up care and it's going to not really lead to greater outcomes because they're just treating it in the moment versus treating your care in the long run.
Okay, so like if you have like the flu or something, would you still go to your primary care provider then, or would you want to just see whoever is first available?
That's a good question. It could be both. So, it just passed flu season, so at the tail end, and a lot of people do both. They come message us, see the primary care provider because I have flu symptoms. You could call in and speak to nurse triage, like, oh, I'm having these symptoms, what should I do? And they could help navigate that for you as well. There's also the option that if you're having like shortness of breath or really hard time breathing and you're worried, emergency room's always there also.
Okay, this is kind of like leading into my next question of like, how do you know which one to pick? Sometimes like maybe you feel like, it's like an intense situation and you have to go to the ER room, but then like maybe you just go and you're like, oh, it wasn't that bad. I could have gone to urgent care. Like, how do you know what to pick?
So in general, that can be tough in the moment. We see a lot of people who come in with chest pain and it's really hard to differentiate like, oh my gosh, I'm having chest pain, I'm going to die. So it's hard to be like, where should I go? I think in the moment, whoever and wherever you need to go, just go. But if you're able to kind of ground yourself and see the symptoms that you're having, you could always call in and talk to our nurse triage, and they can help navigate that for you. But I would say for anything specifically urgent care is there for you, whether that's like injury, an ankle sprain, you hit your head, you have this cut, things like that versus primary care. We do address those things also, but they're typically deal with more chronic or persistent issues.
We mentioned like a nurse line, so is that available 24/7 for all students?
That's a good question. So during work hours, so we're open from typically 8 to 6 on most days except Wednesday. You could call in and speak with a nurse.
Okay.
We do have a outside service that covers the line if you call at nighttime, so there will be someone triaging that, but it's not like we have services 24 hours here. So typically if it's after hours, you would want to go to a local urgent care or emergency room.
Okay, got it. I think the one thing students are concerned about is just like their insurance and like covering on campus. Like, should they go to the on-campus like health department or should they go off campus to like a different hospital? We
see everybody here, all students, regardless of insurance, regardless of what you have. If you have Medi-Cal, if you have private insurance, if you have Kaiser, if you don't have insurance at all, we'll help you. SHIP students is completely covered. Non-SHIP, as long as you're a registered student, there is different fees, and that's something we would be glad to talk to you and help you about when you're in the clinic. So nothing you need to worry about. If you need care, come and see us. We're glad to help you regardless of your insurance.
Oh, that's great. And like, are there any grants for students who can't afford possibly and they don't have insurance but like need care?
Yeah, so there's something we call the Health Equity Fund. I believe historically this originated from the students voting that we accrue late fees for people who don't cancel their appointments. And this went to a pot to help support students who have financial hardships or burdens. So that is always a thing you could access it regardless of if you have insurance or not.
Okay, got it. Thank you. And is there anything else that you would like to tell studying students about the different resources we have here on campus?
Yeah, I actually forgot a couple of things that do come to mind. We do have a dietitian in-house, and we do have a robust team for people who are living with disordered eating. We do manage a lot of that, and that is a thing that I personally manage and a lot of other providers, and I want to make that known because a lot of people don't know that's a resource that we have here.
So for dietitian, do you go through primary care first and then you get prescribed to a dietitian?
Yes, yeah. So that's exactly. You would have to get a referral to see them, but they're glad to help, and they're also, as long as you're a student, they'd be glad to see you also with a referral.
And there's health coaching as well. So is that kind of related to dietitians, or is that a different department here?
That is different. So the health coaching is a little bit more like a health advocate per se, and then dietitian is like a licensed provider, so they can actually give kind of more nuanced treatments and plans and whatnot. But both are access. You have access to both.
Oh. And so all students, regardless of insurance, have access to all these resources?
Yeah, they do have access to these resources. There's a few that may or may not be accessible with outside insurance, but that's something I wouldn't get caught up in the details with. If you really need help, we'd help navigate that for you and then tell you where you can't be seen.
Okay. And so let's just say that I don't have insurance here on campus and I have a headache. And I come for a first visit, but then follow-ups, I want to go somewhere off campus. Can I get referred to a psychiatry clinic or anything not a headache, but anything similar?
Yeah, that's a good question. That one's a little bit more complicated. So if you didn't have insurance at all, we would be glad to see you and help you. We do have a case manager here, so I forgot to mention that. They could help kind of navigate and try to get you connected with insurance, because in that case, that would be the next step. You would need to get some type of coverage, whether it's Medi-Cal, and then we could refer you out. There are a lot of safety net clinics here in Yolo County and Sacramento County that they could connect you with Medi-Cal, so that would be your next step. So say you had a headache, we help you with that, and you want to establish primary care. You could continue being seen here. However, there would be a fee at times, but ultimately we would want you to get some type of sustainable, affordable care. So you may need Medi-Cal and then you being seen at an outside clinic.
Okay. And so what if you have your own insurance? For example, if you have Kaiser, and you come here for the first one, can you go back? Would your reports transfer over there from here as well?
Yes. So you could, if you have Kaiser, you could be seen here. Your medical record won't necessarily be shared with them automatically, but they could also access it if they request it and whatnot. But lots of patients come here and have Kaiser, and we communicate back and forth also. Okay,
got it. I think those were all my questions for today. Thank you so much for your time, RJ.
Yeah, my pleasure. Thanks for having me. And just to put out there, everyone, we want to see you. We'd be glad to help you navigate. I know healthcare is hard, and I still remember when I first went into college and my mom was still making my own appointments. So it can be hard. It can be difficult. There are no wrong questions. So we'd be glad to help navigate that and help you in your need.
Thank you.